Hey guys, it's Dr. Lily Johnston. I am so sorry. You were probably hoping for part 2 of our LP series where we were going to talk about how to manage elevated LP with today's tools. It's coming. I'm sorry. I got really behind over the holidays and it is just not quite ready yet. And so please give us another week to see if we can get that out to you. In the meantime, we are trying something a little new here. My producer has encouraged me to try reaction videos. So we are going to dip our toe into that and get you something to watch this week. So I want to introduce Dr. Kim. I am new to his channel, but I have really enjoyed a lot of the content he has put out. I think we share a similar philosophy in trying to use a lot of evidence-based interventions to help our patients and to go a little bit above and beyond standard medical therapies and also incorporate a lot of the lifestyle medicine. So he has a video on the #1 meal to unclog arteries, which of course is near and dear to my heart. So I wanted to take a watch with you guys and let you know what I think. So without further ado, let's see what Dr. Kim has to say.
Healthy diet is, you're gonna get 10 different answers. Somebody would say, you gotta cut out carbohydrates, or you gotta do keto or carnivore. And another person may say, well, you have to avoid meat and go vegan. And then there's Mediterranean and DASH and paleo. But after more than 10 years of practicing medicine and helping my patients use food as medicine, what I found was that prescribing a diet oftentimes is not that helpful, because many people, not everyone, but many, cannot stick to a very restrictive plan. And none of those diets matter if you can't stay on them. So the way I see it, following a nutrition plan that's only 70% good, but one that we can do for the rest of our lives, is much better than something that's 100%, but we can only stick to it for 6 months. So the goal isn't to chase the next perfect diet, but to pick the most high-yield foods that keep showing up again and again across all studies and meta-analyses that have been done on heart disease, and make sure you incorporate them into your routine, whatever that routine may be. And as we go through these, I also want to go over foods that are sold as heart healthy, but you need to be careful with. And at the end of the video, I want to go over the best exercise and a good supplement that has really good evidence behind them to help you reverse plaques even faster.
So I think I completely agree that there is no one dietary strategy that works for everybody. That makes complete sense and also tracks with my clinical experience. I do want to push back just a little on this idea that all diets are super restrictive. They can be, but I also have to just say, like, nobody wants to change exactly what they're eating. Everybody has gotten into the habit of doing what they're doing, and any change to a nutritional strategy is going to feel a bit restrictive. But it always makes sense to tailor what kind of restriction works best for a given patient. So while there's not one diet that fits all, there always is going to be some kind of restriction, and helping people think through the obstacles, the barriers, and what is going to get in their way with changing their nutrition is more helpful than saying, well, what's the least restrictive thing? Or, the 70% time, like I'm going to eat well 70% of the time. That's okay, but it becomes a super slippery slope for people. And I think that it doesn't allow them the, boundaries to really stay in a therapeutic nutritional approach and guides them in a way that will actually benefit their health. So overall, I really agree. And I do think you have to help people figure out the strategy that meets their goals. So let's see if we have more information about how he approaches that.
Faster. Now, before we go over the best foods, you have to understand how we get plaques in the first place. Because if you understand that process, you'll be able to tailor with more precision which high-yield foods you need to lean into. Because everyone's individual circumstances and risks are different, and what works for one person may not work for you. So arterial plaque buildup is not a simple process. It's not just high cholesterol, and it's not high sugars or high blood pressure or inflammation. Plaque forms with a perfect storm of endothelial damage, which is just injury to the thin layer of cells that lines the inner surface of blood vessels. And then LDL particles that contain ApoB slip through the vessel wall, and then inflammation oxidizes those particles. And that's what triggers your immune system to step in and try to repair the damage. But instead, it just causes the plaque to grow even bigger. And the more oxidative stress in the environment, the more the cycle repeats itself. So the high-yield foods that you need to incorporate into your regimen need to target all those mechanisms.
I agree with the general pathogenesis. I want to kind of even go back to the title though, like the idea that there's one meal to unclog your arteries. What I also want to point out is that this process takes decades. we begin laying down these fatty streaks in our teenage years or maybe even earlier in childhood. So it's not going to be one meal. It's not even going to be 6 months or a year of meals. This is a lifetime strategy or an approach to how we think about atherosclerosis and what contributes to plaque formation. And let's see where we go with the foods to add to the regimen and whether there's evidence that supports whether they are really going to attack this or not. Let's see.
ApoB and reduce inflammation and improve your nitric oxide, which then lowers your blood pressure and protects the endothelium. And finally, you need to calm down that overreactive immune response. So if you look through all the major studies and meta-analyses of diets that help with atherosclerosis, one pattern that emerges is the foods that are rich in lycopene. And lycopene is a carotenoid that's mainly found in red and pink fruits and vegetables. So you
Interestingly, I've read a lot of those studies, and lycopene is not something that I took away from that, but let's hear them out.
get it in tomatoes and guava. Watermelon has a lot of lycopene, then grapefruit, papayas. And lycopene helps because it's an incredibly powerful antioxidant. And one of the main drivers of plaque formation is oxidative stress that leads to cell damage. So lycopene can reverse that by targeting harmful reactive oxygen species. And we have studies that show that high carotenoid levels may slow early stages of atherosclerosis progression. And there was an observational study out of Finland that suggested that lycopene or processed tomato intake may reduce carotid atherosclerosis.
So I think we need to be really careful with these associational studies. All of the trial data and so the PrediMed study is probably the best trial that was an actual randomized intervention of diet on cardiovascular outcomes. You know, that is where you can establish causality. But when we start doing retrospective nutritional epidemiology, that usually looks like asking somebody on a piece of paper how many times they ate tomato, guava, and watermelon in the last year. That's really hard to come up with a number. And then it's even more difficult to decide whether it is the tomato, guava, and watermelon that's associated with their reduced CIMT, or whether it's the fact that they prefer fruits and vegetables to fast food, and that is what we call healthy user bias. So the nutritional epidemiology, these observational studies that we look at, you can actually prove almost any point you want in nutritional epidemiology, depending on how you go back through the food frequency questionnaires and set up your trial or your observations. I'm always a little skeptical of these nutritional epidemiology studies that look at any particular food or nutrient to see if we can make that assessment. The data are just so messy that I find it really challenging to believe that, you know, adding a guava a day is really going to be the difference between your, you know, normal versus below average CIMT. But let's see what else we have.
Now, another recurring theme that I see in all of these studies is phytosterols, which is just a natural plant compound that's found in nuts and seeds, especially flaxseed and sesame seeds. And you can also find phytosterols in legumes and whole grains, and in many fruits and vegetables like carrots and broccolis. And you can find them avocado.
I'll just pause to say that there are many compounds and probably much beyond the phytosterols that are found in many of these foods, but let's keep going.
And in many leafy green vegetables. So phytosterols look almost identical to cholesterol, and when you eat them, they compete with cholesterol for absorption in your intestines, which means less cholesterol can make it through and get absorbed. But that's not where the magic happens, because when it comes to cholesterol in our blood, most of it does not come from cholesterol that we eat. It's the cholesterol that's produced internally by our liver. So how this whole process works is the liver senses a drop in absorbed cholesterol, and because your liver tries to maintain its own cholesterol balance and homeostasis, it starts pulling more LDL particles out of the bloodstream. So over time, you basically get less LDLs that carry ApoB moving through your arteries. And that's important because LDL, and more precisely ApoB, has been shown to cause heart disease. If you look at
the point about phytosterols is accurate but incomplete. So phytosterols do compete for absorption with cholesterol, and it does have a direct lowering of LDL-C or LDL cholesterol or ApoB particles. There is also a suggestion that in people who are hyperabsorbers, so again, there's the synthetic pathway in the liver where the liver synthesizes its cholesterol. There's also the absorption pathway that we just talked about where we absorb sterols from our food. There are some people who are very efficient at absorbing sterols from food. Those people, when they absorb phytosterols, seem to have an increased oxidative response. And I'll link a study in the description below, but Tom Daysprings actually talked about this. And I'm always a little bit concerned about actively using phytosterols to lower LDL-C. It's been discussed in the cardiology literature for quite some time. The piece that we're missing is an outcomes data piece. So the studies that have used it do show LDL-C lowering, and yes, overall lowering LDL-C is important. The degree to which phytosterols lower LDL-C is typically not dramatic. We can put it in the description exactly how much, but it's less than any pharmacotherapy that we have, I would say, currently on the market. And if there is an increased risk of oxidizing those sterols, we've already talked about oxidative stress and the fact that that may actually create more plaque formation or more inflammation in the artery wall if we are depositing any sterols in there at all. So I'm a little concerned about the phytosterol piece, but I will say that's very well accepted in the cardiology space right now, and I am a bit of an outlier in that way.
Meta-analyses, and if you look at the Mendelian randomization studies, it is one of the main drivers of atherosclerosis. It's not the only factor, but it's key in developing plaques. And we have several meta-analyses that show that eating more phytosterols can significantly reduce your LDL with an average reduction of about 14 milligrams per deciliter. Okay, another food that is
so again, 14 milligrams per deciliter on average is, if you're starting with an LDL-C of 150, that's going to take you down to 135. You're still really nowhere near goal, and it's not going to be enough to move the needle for reabsorbing plaque or for regressing plaque. It's certainly helpful. It's better than nothing, but it is not where you're going to need to be most of the time. Let's talk about flavonoids.
essential for plaque reversal are flavonoids, which are just natural compounds that are found in fruits like berries and apples and oranges. You can also find them in onions and leafy greens. And there's a lot of flavonoids in dark chocolate. So this is how they work. When plaque builds up in your blood vessels, it starts with LDL particles getting trapped and damaged in the inner lining of your blood vessels. And this LDL particle starts getting oxidized, which makes the whole area very sticky. So white blood cells, called macrophages, are drawn to that area and they cause inflammation. And this whole process is what makes the plaque grow. So this is where flavonoids come in. They lower that adhesion molecule expression. Basically, they make arterial walls less sticky so fewer cells can attach. And that in turn lowers inflammation and it helps macrophages work in a calmer way so they don't turn LDL into its damaged and oxidized form. And one subset of flavonoids that is especially important is catechins, which you can find in green and black teas. And there was a meta-analysis that looked at 9 prospective studies that showed that drinking 3 or more cups of green or black tea is associated with a 21% reduced risk of stroke compared to the consumption of less than 1 cup per day. Now, and
again, we're talking about nutritional epidemiology here. This was not an interventional trial. This is just retrospectively looking at who drinks tea, who drinks coffee, and what, we're assuming how many polyphenols and flavonoids are in that tea. We have no way of controlling that, really. So again, interesting if true, but I would not say that there is a demonstrable role for, I haven't seen a study that shows it actually stabilizes plaque. We don't have an outcome associated with that. That is really just, well, the outcome was associated with the tea, but we've not shown that it was exactly what was in the tea and what dose and to what degree was plaque regressed at all. We don't know that. We do know inflammation is key, absolutely, in the formation and propagation of plaque, but we are not sure exactly what role the anti-inflammatory components in our food turn into things we actually absorb. So do they cross the gut? Do they stay anti-inflammatory? Are they causing any issues in the body? We don't know. And what you would love to see would be an actual reduction in an inflammatory marker like high sensitivity C-reactive protein, hsCRP, or LPPLA2, an actually vascular specific marker of inflammation that's relevant to plaque. If we saw that, then I would be much more, bearish about or bullish about the idea of, antioxidants in tea causing plaque regression. But I haven't really seen data to support that quite yet. Let's see what else we got.
Another important and very powerful nutrient is extra virgin olive oil. Now, this pops up across many studies, and high intake is associated with a significant reduction in major cardiovascular events like heart attack.
So here, actually, the data are quite compelling, and this was really from the PrediMed trial. So this was a randomized controlled trial, and they had two separate arms. One was an olive oil arm, and one was the extra nuts arm. And the olive oil arm actually did have a reduction in events. So I think this is actually very compelling, and I'm excited to see this presented. The key about olive oil is making sure that it's actually true olive oil. I think there's been some discussion in popular media that some olive oil has been adulterated with canola oil or soybean oil or other forms of non-olive oil. And so making sure that what you're getting is in fact 100% olive oil is the most important thing if you are going to add that to your nutritional strategy for cardiovascular risk reduction.
Olive oil is very high in polyphenols and monounsaturated fats, which have antioxidant and anti-inflammatory properties. So they help smooth out the damaged endothelium or arterial inner lining. And on top of that, olive oil may also help with insulin sensitivity and reduce inflammation. So mechanistically, you target multiple steps that lead to atherosclerosis. Now, another
I would say we don't actually have any idea what the active component of the olive oil is. All of those are plausible mechanisms, but I'm not sure we really know exactly what it is in the olive oil, whether it's the fatty acid composition, whether it's the polyphenols. I'm not sure I know what's doing that, but let's see what else we know about fatty fish here.
Another food that will help is fatty fish like salmon and mackerel or sardines. These fish are rich in omega-3 fatty acids, especially EPA and DHA. They're incredibly important in keeping your heart and blood vessels healthy. There's clinical studies that show that people eating fatty fish 1 to 3 times per week had a lower risk of heart disease and strokes. And then we have the multi-ethnic study of atherosclerosis, which is one of the largest and longer running studies on heart disease that found that higher DHA levels was associated with a 12% lower risk of carotid plaque progression. So this is the plaque that can lead to strokes. These omega-3 fatty acids calm down the immune response that aggravates plaques, and they can also increase your nitric oxide production, which then stabilizes the plaque and makes it less likely to rupture and cause clots and problems downstream. Now, when it comes to atherosclerosis, it's not enough to eat the right.
So let's think about the omega-3s for just a second. I think this is an area that is very promising and rich, but what we have learned is that the dose is important and the specific fatty acid is important. And he didn't show the best trial that we actually have, which was the Improve It trial. And that was icosapent ethyl. And that is a very specific formulation, and it was intended for patients with elevated triglycerides. And they absolutely had a reduction in adverse cardiac events. I was a little confounded by the fact that the placebo group was given kind of a pro-inflammatory oil, so it's not entirely clear whether it was truly the icosapent ethyl that improved things or whether the placebo actually made things worse. That is a subject of some debate, but I would say in the cardiovascular community, the emphasis has gone away from the fish oil supplementation to encouraging fatty fish, which is great, although you always have to be careful about what else comes with your fish, whether there's heavy metal toxicity or microplastics or the pollution from fish farming. There's all kinds of things that are troublesome about the sort of aquaculture of fish and how we get our fish supply and all of that. Nevertheless, some fatty fish is probably a good thing. The smaller fish, the less likely you are to be influenced by the heavy metal toxicity. And then if we are using therapeutically omega-3 fatty acids, then getting the least oxidized, cleanest, best absorbed form is optimal. And I would say icosapent ethyl is the one that actually does have outcome data behind it. The other caution would be at high doses, we have seen an increase in atrial fibrillation with a lot of omega-3 use. So you have to weigh the risks and benefits of, are we doing this for elevated triglycerides? Are we doing this just to take a supplement instead of a medication? Where are we coming from on this standpoint? And, if we're using it in a targeted fashion, should we use the pharmaceutical grade at the dose that's been recommended? How do you want to think about that? So the omega-3 question, I would say, is still a little bit up in the air, and it's not the right answer for everybody and should be taken with a bit of a grain of salt.
foods, but it's also just as important to try to limit certain foods, especially foods that are very inflammatory. So no surprise here, but we especially want to be careful with processed carbohydrates like pastries and cereals and any foods that are full of sugar or fructose. So some of the most common offenders that I see. So we're talking about foods that are promoted as heart healthy, but they're actually harming you. Flavored yogurts. Many of them are packed with added sugar. So it's much better to buy plain full fat yogurts and just add your own sweetener of choice for taste. Now at this point, most people know that most breakfast cereals are basically dessert and just processed sugars, but there's alternatives that masquerade themselves as healthy but are not really that much better. So I'm talking about many breakfast bars or granola bars. Make sure you look at the ingredient labels, as many of those are still packed with sugar, but just with healthier packaging. And another sneaky food that I always bring up is, well, it's not a food, but it's a drink, and it's juices. If you drink apple juice or orange juice, any type of juice, you're probably getting a lot of added sugars. But even if the label on the bottle says there's no added sugars, or this product only has natural sugars, well, these sugars may be natural, but they're still absorbed in a highly concentrated form. And another problem is these juices don't come with a protective fiber that we would normally get if we're getting it from a fresh fruit. So as I mentioned before, fresh fruits are wonderful and they're heart healthy, but it's very easy to overconsume sugars and fructose in the fruit if you're getting it in liquid form. Now, as a bonus, here's some non-food related things that will also help you expedite reversing.
I was really waiting for him to talk about my favorite breakfast villain, which is oatmeal, which some people tolerate really well. Don't get me wrong. And the beta glucan that's in unprocessed oats can actually be a part of a nutritional approach for lowering LDL-C. But in general, I have found, especially people with diabetes or insulin resistance, many of them, when they wear a glucose monitor or check their blood sugars, will find that they spike considerably after oatmeal. And so in addition to breakfast cereal and granola, which I completely agree with, and juice, which I ask none of my patients to consume. I ask them all to stop drinking juice if they can. Then above and beyond that, many of them tell me that they have oatmeal and they thought that was a healthy substitute for Cheerios or any of the other breakfast cereals that they were having before. And lo and behold, when they check their sugars, they are still spiking. So breakfast is a tough one for people. And I'm interested that, we're about to, I think, switch into non-food things. And we didn't even settle on a nutritional strategy for many people, but we did talk about the inflammatory impact of high glycemic foods. And I wish we could have delved into a little more detail there, because I actually do think there are a lot of data that support the negative impact of highly processed carbohydrates in particular. And it's a subject of debate whether some people do well on a moderate or even a low carbohydrate approach, and others may not. But that is actually a very rich area, and the Virta Health Group has done a really nice job showing that we can reduce cardiovascular risk markers even on a very low carbohydrate diet, which again, I recommend to many of my patients and not to some. It's not a perfect strategy for everybody, but it's not an automatic heart attack in a frying pan either. It's actually very helpful for many patients, and many of them don't find it that restrictive. So I would love for Dr. Kim to have kind of circled back to, like, what does he recommend for his patients, rather than just a list of foods to add and foods to avoid, and hoping people kind of remember all that. I don't think that doing that without a framework is very helpful for many patients, but let's see what else we are going to talk about for unclogging arteries in a meal.
Your atherosclerosis. First, no surprise here, but exercise is extremely important for your heart health. But there's one type of exercise where we actually have evidence in showing that it can reverse arterial plaques. So there was a randomized control study published in the European Journal of Preventive Cardiology that showed that just 6 months of supervised high intensity interval training, or HIIT, showed a significant reduction in plaque volume. And what was especially amazing, the plaque volume regression after 6 months of this exercise was slightly larger than what they observed with statin intervention. Now, because atherosclerosis is a disease that develops over many years and decades, we don't know how that translates to actual clinical outcomes, but the initial results.
I actually think this study is amazing, and I'm so glad he presented this. I had not seen this trial, but I am going to go read it right after we're done here, because I'm actually really impressed the fact that they took the atheroma volume, which means they did a fair amount of imaging before and after this exercise intervention. Now, you have to be a little careful with HIIT and what that really means, how they defined it. But overall, again, this is an intervention study, and they have really hard evidence on plaque regression, and that is really cool. I'm very excited about this.
results from the study are pretty remarkable. Now, beyond exercise, there is one supplement that I want to highlight that actually has decent evidence in slowing the progression of coronary atherosclerosis, and that is aged garlic extract. So there was a double-blind randomized control trial that showed that aged garlic extract can stabilize vulnerable plaques. And there was another randomized control trial that showed that the group that was randomized to take an aged garlic extract for 1 year had a lower progression of coronary artery calcification and improved blood pressure. Now, one more bonus tactic that I recommend to my patients that may help improve cardiovascular health, and that is sauna therapy. Now, this is not something where we have direct evidence that shows plaque stabilization or regression with sauna, but there's plenty of indirect associations. So there's studies that show a link between sauna bathing and improvement in endothelial function. And there's meta-analyses like this one that show that sauna can help with blood pressure. Now, most of the evidence is based on observational and mechanistic data, but there is enough indirect data that supports its health benefits. Not just when it comes to heart disease, but there's also a link to a significantly lower risk of all-cause mortality. So based on
With respect to the garlic extract, I am aware of this, but I have not done my own personal deep dive into garlic extract yet. So if you guys are interested in having me go deep into that literature and see what that's all about, let me know in the comments. So far, it seems kind of promising. I've seen other supplements that I thought had good trial data behind them and have, in my practice, turned out to be not that effective for my patients. So I'm always a little bit skeptical of that. However, I understand how much demand there is for supplement-based treatment approaches, and I always like to be up on that. So I think my homework is going to be to do a deep dive on the garlic extract. The sauna data mostly comes from Finland, and it's dry sauna, which is usually much hotter than a lot of the infrared saunas that are being used in the United States. We don't know if the hot sauna data will actually translate to the infrared saunas, but heat shock protein and some of that basic science is very interesting and does support, at least mechanistically, why there should be a benefit related to sauna, and it feels amazing. So I think that that's a great idea for most people, and I always like recommending that if patients ask about it.
On the current imperfect evidence, I still think it's a worthwhile intervention to try if you have access to saunas. All right, I hope this was helpful. Stay healthy, and I'll see you in the next one.
So wrapping that all up, I don't feel like I walked away with a meal that is going to unclog arteries. I think we talked about some functional foods, we talked about some inflammatory foods, and we skirted around the idea of ApoB, LDLC, and inflammation and endothelial damage and how nutrition can potentially contribute to all of that. But I don't think we really walked away knowing exactly what to eat to help us ameliorate or reverse plaque. The exercise study on high intensity interval training was very interesting, and I actually think that might be the big gem in that video. And we also talked a little bit about the idea of diets as very restrictive, and I don't know how I feel about that. I have worked in communities where people have been on a way of eating, they call it that instead of a diet, for years and years and years. And I have been eating in the way I eat for over 5 years now. And while many would call it restrictive, I find it quite liberating and it helps me out. So I would like to thank Dr. Kim for putting a lot of really great information together in one video. We're going to be cautious about our nutritional epidemiology and recognize that it's very difficult to take away anything from our nutritional literature, and we do the best we can. And at the end of the day, most people really know ballpark what is good for them to eat and what is not. And if we're really just going to stick to like the 80-20 rule, if you're walking around the edge of the grocery store and it grew in the ground or can perish and go bad, then it's probably reasonable. And if it comes in a box or a bag from the middle of the grocery store and it will last through the next nuclear winter, it's probably not a great thing for us to be eating a lot of. So, if we're really going to oversimplify it, that's one way to do it. In another video, maybe we can talk about how I like to think about nutrition and how I talk about that to my patients and how I counsel them. But overall, there were some gems in there, and I think it was worth a watch. So thanks, Dr. Kim, for putting that together for us. Like this video, please subscribe or share it with somebody in your world that you think needs to hear it. Until next time, take really good care.